Hi everyone, this is the second part of the leg and foot lecture, and in this section I will talk about the different compartment of the legs and the muscles of the different compartments and the blood vessels and nerve. The leg bones are the tibia and the fibula. You can see in this illustration, this is a cross section of the leg, and the tibia and fibula are the bones of the leg. It is covered by the skin, superficial fascia. The superficial fascia has less fat than the other parts of the lower limb on the leg. The deep fascia of the leg is strong, and it is called the crural fascia. The crural fascia or fascia cruris is continuous superiorly with the fascia lata of the thigh. The deep fascia of the leg is attached to the periosteum of the tibia on its anterior border and the medial side. And you can see the anterior border and the medial surface of the tibia is underneath the skin, and that is subcutaneous. The anterior border and the medial surface of the tibia is very superficial underneath the skin on the medial side of the leg, and this anterior border and the medial surface of the tibia is called shin. The anterior border of the tibia gives attachment to the deep fascia, and the deep fascia, it surrounds all the muscles of the leg, and also it sends intermuscular septum in between the muscles and divide the muscles of the leg into different compartments. See, there are two intermuscular septum, the anterior intermuscular septum and the posterior intermuscular septum. These intermuscular septums are attached to the fibula. And there is an interosseous membrane which connects the interosseous borders of the tibia and the fibula. In between this interosseous membrane and anterior intermuscular septum and posterior intermuscular septum, there are three compartments of the leg, three muscular compartments of the leg. Anterior to the interosseous membrane is the anterior compartment. It lies in between the anterior intermuscular septum and anterior interosseous membrane. It lies on the lateral aspect of the tibia. The anterior compartment of the leg, it contains mainly three muscles of the leg. These muscles are the dorsiflexors of the ankle joint and the extensors of the toes. The smallest lateral compartment of the leg, it lies lateral to the fibula in between the anterior and posterior intermuscular septum. The lateral compartment of the leg, you can see here, it has only two muscles, and these two muscles are the everters of the foot. The large posterior compartment of the leg, it lies posterior to the interosseous membrane, and it lies in between the posterior intermuscular septum, and it lies over the posterior surface of the tibia and the fibula. The posterior compartment of the leg is again divided into two parts by another transverse intermuscular septum. See the transverse intermuscular septum? It divides the large posterior compartment into superficial posterior compartment and the deep posterior compartment. The superficial posterior compartment contains the two-headed gastrocnemius muscle and the soleus muscle, which forms the large superficial muscles of the back of the leg, and the deep posterior compartment of the leg contains again three muscles. And in between this superficial and deep compartment, deep to the transverse intermuscular septum, the blood vessels and nerves are entering into the posterior compartment of the leg, and they supply all the muscles of the superficial and deep part of the posterior compartment of the leg. So the anterior compartment of the leg, it contains three muscles. See here, this is the anterior compartment of the leg, which lies anterior to the interosseous membrane, but it lies from the lateral surface of the tibia. So the three muscles within the anterior compartment, the most medial one is the tibialis anterior. Then the most lateral muscle of the anterior compartment of the leg is the extensor digitorum longus. And then in between these two muscles, the extensor hallucis longus. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. These are the three muscles of the anterior compartment. And the tendons of all these three muscles, they are entering into the dorsum of the foot under the thickening of the fascia. They are a thickening of the fascia. These are called retinaculum. And the tendons of this muscle entering into the dorsum of the foot over or they are crossing over the ankle joint, and they are entering into the dorsum of the foot. Here you can see the tendon of the tibialis anterior, extensor hallucis longus, and extensor digitorum longus. All are entering over the ankle joint, and they are covered, or they are holding in, these tendons are holding in position by this thickening of the fascia, which we call the retinaculum. These are the extensor retinaculum. There is a superior extensor retinaculum and inferior extensor retinaculum. Inferior extensor retinaculum is Y-shaped. The superior extensor retinaculum, it binds the tendons of the anterior compartment muscles with the tibia and the fibula. And this retinaculum, they helps in maintaining the position of the tendons of this muscle during the movement of the ankle joint. During the dorsiflexion, these retinaculums, they prevent the bowstringing of this muscle during the dorsiflexion of the ankle joint. So these retinaculums are important for maintaining the position of the tendons of this muscle. The tendon of the tibialis anterior is attached on the medial side of the medial cuneiform and the base of the first metatarsal bone. The tendon of the extensor hallucis longus, hallux means great toe, this tendon is going all the way up to the distal phalanx of the great toe. Extensor hallucis longus is the long extensor of the great toe. And the extensor digitorum longus, it has four tendons, and the four tendons of the extensor digitorum longus is attached to the distal phalanx of the lateral four toes. And these tibialis anterior, extensor hallucis longus, extensor digitorum longus, these are the dorsiflexors of the ankle joint, and they are the extensors of the toes. There is another small muscle which attached on the lateral side of the extensor digitorum longus muscle, and it forms the fifth tendon. It forms the fifth tendon of the extensor digitorum longus. See, these are the four tendons of the extensor digitorum longus which attach to the toes, but the fifth tendon of this muscle, a small muscle, this muscle is called fibularis tertius. This muscle, if it is not always present, if it is present, it belongs to the anterior compartment muscle and supplied by the same nerve which supplies the muscles of the anterior compartment. The fibularis tertius muscle, the fifth tendon, is attached to the base of the fifth metatarsal bone. This tendon doesn't go to the toes. Over the dorsum of the foot, there are two short muscles. Those are considered as the muscles of the dorsum of the foot. These are the extensor hallucis brevis and extensor digitorum brevis. Extensor hallucis longus is the long extensor of the great toe, and extensor hallucis brevis means short. This is the short extensor of the great toe. See, the small tendon is attached to the lateral side of the tendon of the extensor hallucis longus, and it helps in the extension of the great toe. And the extensor digitorum brevis is the short extensor of the lateral toes, and it forms the small tendons which attach to the lateral side of the tendon of the extensor digitorum longus muscle. Extensor hallucis brevis and extensor digitorum brevis are over the dorsum of the foot, and they consider as the muscle of the dorsum of the foot. The nerve of the anterior compartment of the leg is the deep fibular nerve. The common fibular, one of the terminal branch of the sciatic nerve that courses with the tendon of the biceps femoris. tendon of the biceps femoris is attached to the head of the fibula, and the common fibular nerve courses around the neck of the fibula. And while it is surrounding the neck of the fibula, it is very superficial. And then it goes deep to the fibularis longus muscle, which is one of the muscle of the lateral compartment of the leg. And in this position, the common fibular nerve is divided into two branches, two terminal branches. One is the superficial fibular nerve, and another one is the deep fibular nerve. The deep fibular nerve enters into the anterior compartment, and it courses with the anterior tibial artery. First, these anterior tibial artery and deep fibular nerve, they lie in between the tibialis anterior muscle and the extensor digitorum longus muscle. Then these two structures are passing in between the tibialis anterior and extensor hallucis longus muscle. And the deep fibular nerve enters into the dorsum of the foot in front of the ankle joint under the extensor retinaculum. And deep fibular nerve, it goes all the way at the junction in between the first and second toe. Deep fibular nerve supplies all the muscles of the anterior compartment, including the fibularis tertius, and also it supplies the two short muscles over the dorsum of the foot. And finally or terminally, it gives rise the digital branch. The digital branch of the deep fibular nerve supply the skin in between the first and second toe. The superficial fibular nerve, that courses through the lateral compartment muscles and supplies the lateral compartment muscles. The blood vessel of the anterior compartment is the anterior tibial artery. Anterior tibial artery is one of the terminal branch of the popliteal artery. It enters into the anterior compartment of the leg through the gap or opening which lies on the superior aspect of the interosseous membrane. See, this is the opening. So anterior tibial artery enters through the gap over the interosseous membrane, and then it courses with the deep fibular nerve. Anterior tibial artery courses with the deep fibular nerve in between these muscles. Then in front of the ankle joint, in between the two malleoli, the medial malleolus and lateral malleolus, the anterior tibial artery is continuous over the dorsum of the foot. And in between the two malleoli, it changes its name. It continues over the dorsum of the foot, which we call the dorsalis pedis artery or artery of the dorsum of the foot. Dorsalis pedis artery is the continuation of the anterior tibial artery at the level of the two malleoli. In between the two malleoli, the medial malleolus, lateral malleolus, it changes its name. At this point, the dorsalis pedis artery is very superficial. You can see here the dorsalis pedis artery is very superficial while it lies in between the two malleoli anterior to the ankle joint. It lies just lateral to the tendon of the extensor hallucis longus. And at this point, we can feel the pulse of the dorsalis pedis artery. And dorsalis pedis artery pulse is usually the physician, they feel the dorsalis pedis artery pulse in front of the ankle joint, just lateral to the tendon of the extensor hallucis longus. And it is important for the diagnosis of the peripheral vascular disease. Then the dorsalis pedis artery, it courses over the dorsum of the foot. It courses over the dorsum of the foot with the deep fibular nerve. You can see the deep fibular nerve also coursing together. And this dorsalis pedis artery, it divides into two terminal branch in between the base of the first and second metatarsal bone. At this point, the dorsalis pedis artery is divided into two terminal branches. One is the deep plantar artery, another one is the first dorsal metatarsal artery. The deep plantar artery, it passes in between the first dorsal interosseous muscle, and it goes deep, and it goes to the sole or plantar surface of the foot. And deep plantar artery participates in the sole of the foot in the formation of the deep plantar arterial arch. And the first dorsal metatarsal artery, it goes more anteriorly, and it gives rise the dorsal digital arteries, which supply the sites of the first toes. You see the dorsal digital arteries that supply the digits. And dorsal epiphyseal artery also give rise other branches. There is a lateral tarsal artery. Lateral tarsal artery, it passes deep to the muscle, deep to the extensor hallucis brevis muscle. So it is difficult to see on the dorsum of the foot because it is underneath the muscle. And also the arcuate artery, another branch, arcuate artery crosses transversely over the bases of the second, third, fourth metatarsal bones. And arcuate artery give rise the dorsal metatarsal arteries, which courses in between the metatarsal bones, and that give rise the dorsal digital branches which supply the lateral side of the lateral foretoes. The lateral compartment of the leg that lies lateral to the fibula, the smallest compartment of the leg, it contains only two muscles, the fibularis longus, which has a long tendon and more superficial, and fibularis brevis. Deep to the fibularis longus is the fibularis brevis. So by name you can tell fibularis longus is the long one and fibularis brevis is the short fibularis muscle. And these muscles are the everters of the foot. These are the everters of the foot. They raises the lateral margin of the foot. The fibularis longus muscle has a short muscle but long tendon, and fibularis longus and fibularis brevis muscle tendon, they are passing behind posterior to the lateral malleolus, and they are coursing posterior to the lateral malleolus. Fibularis brevis tendon lies closely with the lateral malleolus, and then over that is the fibularis longus tendon. Fibularis brevis muscle is attached distally into the tuberosity of the fifth metatarsal bone. And fibularis longus tendon, it passes with the fibularis brevis tendon under this, or posterior to the lateral malleolus under these retinaculums. And then fibularis longus tendon, it crosses the sole of the foot from lateral to medial, and medially it is attached to the medial cuneiform and the base of the first metatarsal bone. Fibularis longus and fibularis brevis, these two muscles get the nerve supply from the superficial fibular nerve. The superficial fibular nerve is another terminal branch of the common fibular nerve, and that supplies these two muscles of the lateral compartment of the leg. And then after supplying this muscle, it pierces the deep fascia on the distal part of the anterolateral side of the leg, and this superficial fibular nerve become cutaneous at this point, and it give rise the dorsal digital branches over the dorsum of the foot and supply the skin of the distal part of the lateral side of the leg and the skin over the dorsum of the foot. Except the first dorsal metatarsal space that is supplied by the digital branches of the deep fibular nerve. The common fibular nerve is, I mentioned that it is very superficial over the neck of the fibula, and if the neck of the fibula is a narrow part of the fibula, and in case of fracture of the neck of the fibula, this common fibular nerve can get injured, and this common fibular nerve, if it is get injured here, the muscles of the anterior compartment will be paralyzed, and the dorsiflexion of the ankle joint will be hampered, and then this condition is called the foot drop. So common fibular nerve injury is common in case of fracture of the neck of the fibula, and it causes the foot drop.